Hi, I'm Dr. Loria, and today we're going to talk about the sleeve procedure. Sleeve is part of the LEAP procedure, right? LEAP stands for Loria's elongation and extension penile procedure, right? There's two components to the LEAP. One is the release, which is for erect lengthening. One is for the sleeve, which is primarily flaccid lengthening, okay? We're going to talk a little bit more about the sleeve. Very excited about the sleeve. We're getting super results, excellent results, consistent results. The release, we're getting good results, no question, but there's a variation in the length that we're getting. Right, a half inch to an inch is probably right on mark for the erect length on the release. But sleeve is more reliable. It's more consistent because when we put a sleeve in, let me just explain what that is. Let's say, for example, here's your penile shaft and glans, okay? If we put something here to prevent this from retracting back, it's going to hang longer, right, during the flaccid state. It's going to prevent this retraction force. As you know, when you're flaccid, what happens is the penis retracts incredibly. I mean, it can contract to an inch. I had patients where it contracted inside their bodies, right? Actually, we will call them an innie. It's kind of a joke, but the point is that the state of the flaccid penis is very short. Nobody likes that. We know that. Okay, so what we do in regarding the sleeve and the purpose of it is we slide it kind of under the skin here and mount it right here. Okay, this is the penile shaft, and it keeps it hanging long all the time. Okay, now the question is that I get from most patients is, do you feel it? Right, you put the sleeve in here, whatever that is, right, this device, and how does it feel? Well, originally we were putting them in with patients who have had no girth treatments, okay? So if you put it in and you have this thin penile skin, you could feel it, right? So then we changed gears a little bit. We said, you know what, let's do a couple of treatments of filler. Let's get that shaft a little girthy. Let's say the shaft is 5 inches in girth, erect. Let's get it to maybe 6.5, 7. So now we're thicker, right? Now, when we slide the sleeve under, you can't really feel it that much because you have to feel through all that collagen thickness, right? So it winds up being a perfect marriage between filler and sleeve together. You put them together, of course you get your girth. It's a separate treatment, that's filler treatment, permanent filler. But you get the sleeve in there so you're hanging long and it feels natural. Because remember, when you do the filler, it's going to thicken you with a lot of your own natural collagen, right? So when we make a little incision by the circumcision line and slide it under, okay, and also we make a tiny incision here just for anchoring purposes, but we're going to slide that device in, anchor it. It's going to be, and we're going to, of course, close this area with a couple sutures, close here with a couple sutures, and let that heal, right? Because it has to encapsulate as well, and so forth. The body has to do all these things so to stabilize it. Point being that now the shaft is going to hang very long, okay, and you're going to barely be able to feel it because, you know, when you have all that collagen around it. So again, we switch gears from the beginning where we were offering this first, put the sleeve in, and then do your filler. But it was reversed. We had to reverse that. We preferred doing, there's another reason why we reversed it. You'd say, well, what if you put the sleeve in first and you know you're going to feel it, but then you know you're going to do filler anyway, right? So you're going to fill it up with filler and so forth, and the end result is the same. Well, not necessarily, because the issue we had with putting the sleeve in first without filler is there was a lot of inflammation. It's just too difficult for the tissue, right? Because remember, the skin of the penis is paper thin, right? So we have to kind of get in there and kind of slide it in and so forth. So that thin skin doesn't handle it very well. It gets very bruised and so forth. But when we put permanent filler in first and you get that thick collagen development, it's like steel. I mean, it's like you put that sleeve in there. I mean, it barely gets traumatized at all, okay? Because it's kind of sturdy, thick skin now. It's like this as opposed to this. Right? It's thick and it's sturdy and it can handle some stress. All right, so that's why we prefer to do the filler first, then slide the sleeve in. Now, the sleeve has a lot of benefits. Let's go over these benefits. Number one, of course, it optimizes flaccid length. right? So when you're just naturally there, sitting there or standing and looking at yourself, the penis is going to be hanging pretty long. Okay, so for example, if your erection is 6 inches long, the objective is to get your flaccid 6 inches as well, if not more. Okay, we're going to talk about how we can get it a little bit more than that, but we want it to hang close to that 6 inches. So you're 6 inches pretty much all the time. Instead of that 6 inches retracting back during the flaccid state to 1 inch. Okay, so it prevents that. So it helps optimize flaccid length. If you have some stretch to the penile shaft, let's say, for example, let's say you're sitting here and we're checking your penile shaft, and we could stretch it beyond 6 inches, because sometimes there's certain amount, some patients have more elastic fibers or elasticity in their penile shaft. So if I could stretch it out to 7, even though they're erect to 6, but this is an artificial way to stretch it out, right? Pull it and stretch it. Let's say we could pull it to 7. I might be able to anchor a sleeve in there to hold it at 7. So now you're flaccid at 7 and erect at 7. Now, not many patients have that characteristic of having that elasticity characteristic. Okay, it's very important to understand that the objective primarily is to increase flaccid length. Secondarily, if we can get some erect length out of it, great. That's the way I look at it. So number one is you're going to get optimized flaccid length with the sleeve. Number two, there's a possibility of getting some erect length, especially if you combine the sleeve with the release. Okay, they work synergistically. But again, the sleeve primarily is for flaccid length. Number two, it could increase the girth of the shaft by about a ½ inch. Okay, that's a plus, right? Number three, it keeps the glands out. Now, what do I mean by that? When we do filler treatments, right, we thicken up the shaft and so forth. It goes from 5 inches to 7 inches and so forth. The penis still wants to retract, and the only part that we've noticed is that the glands likes to kind of sneak under, and it makes you look like you're uncircumcised, right? Some patients care about that, some don't. Okay, but if you're going to do the sleeve locks in the glands where it can't move, right? So the glands can't tuck under. So it helps with that particular issue with you looking uncircumcised. So you put the sleeve in, you get flaccid length optimization. Number two, you get a girth increase of a ½ inch. Number three, the glands will stay out. Okay, so it's going to look more natural. Okay, so those are the three main benefits you get from the sleeve. Also, there's a fourth benefit of confidence, right? It's not something you could see, but we all feel good about it. As men, we kind of know how we think. We all think the same no matter where you are in the world, that if you're looking better, you're feeling better, period. Doesn't matter. Okay. Now, the last benefit that you get from the sleeve is you can increase the firmness of your erection with that. Okay. So for those who have erectile dysfunction, it may assist you in helping that situation, right? Because the sleeve itself is silicone rubber, but it's flexible, but it has some firmness to it, so it's going to help you there. Those with Peyronie's disease, it could help with that as well. And also, if you have a little bending with Peyronie's, that's one of the aspects of it. Peyronie's disease is a scar tissue development within the deep parts of the penis. If you get some bending, the sleeve might be able to help with that too. All right, so there's other benefits to the sleeve. Okay. Now, if you have more questions about it, you can certainly let us know and ask us. You can go to loriamedical.com. We try to put as much information there as we can, and also check out the results on the gallery page. We're going to update it, as much as we can. Try to get results of what the sleeve looks like and so forth. You could always email me as well, info@loriamedical.com, if you have specific questions. Okay, so hopefully we'll see you guys in our office, ready to do the sleeve, because the sleeve's I think it's a great device. And remember, if you couple up the release with the sleeve, you get a synergistic effect. The release, again, is for erect length. Sleeve is for flaccid length. But when you do them together, and I don't mean on the same day, you might do the release and then a month or two later do the sleeve. But bottom line is, when you have both done, they act synergistically to help. For example, if you get, let's say, a ½ inch gain on your erect, and you put the sleeve in, it might actually go to an inch or more. If we just put the sleeve in and you get just, let's say, your normal optimized flaccid length, right? If you add the release to that, sometimes that even goes further. So your flaccid length will increase. So that's how they work together, okay? Again, any questions, give us a call. Hopefully we'll see you soon.